Welcome everyone. This is Dr. Ibrahim Jaffe, and I'm very happy to be on the call with you all tonight. Let me just make sure that you can all hear me before we start the call. Would you push a *2 on your phone if you can hear me? Just *2. It shows up as a little hand on my phone, on my computer here, and I know that you're able to hear me. Look, there we go. Beautiful. Okay, thank you all very much. Let me just lower your hands. And just a couple logistical things. If you are having trouble hearing me, you can push a *3 or *4, and it will raise and lower the volume on your call. So if you wish to hear, if you're having trouble hearing, just go ahead and push *3, *4. And if you wish to speak, all you have to do is push a *2. I'll see you on my computer screen here, and I'm happy to talk with you. All right. So tonight is an introduction to the Patient Healer Program, or what we're calling the Breakthrough to True Healing. And this is a very powerful, exciting, and new course that is the first time that this course has been offered. And I believe it is without question, the most profound healing course that I have ever done in my 30 years of healing, and the most powerful healing course that I have seen offered in the United States at this time. So it's a very, very special course, and tonight we're going to be talking about what that program is, the value of it, the benefits of it, and what you're going to be learning. And we're also going to be having some of the people who I've worked with, and they're going to come on, and they have healed major disease, and they're going to come and speak to you a little bit about how the program works from their perspective, and so you understand exactly the power and the benefits of this program. We're going to be talking about to one of our beloveds who healed very, very serious congestive heart failure, and we're going to talk to another beloved whose son was actually considered essentially brain dead at the time of his birth, and we did the healing and how he recovered completely from that healing. So these are some very, very powerful testimonials that will help you understand what you can do and how it worked and what happened in that process of healing. So I'm very, very delighted to speak with all of you, and I hope this is not just for you, but I want you also to pass this on to your friends, to anybody you know who may be struggling with life-threatening disease, chronic disease that they haven't been able to heal, cancer, heart disease, Lyme's disease, anything else, MS, any of the diseases that are the strongest and most powerful and most difficult diseases to work with, even for allopathic medicine, the places where they give up and they say, well, we can't heal this. This course is for those people. It's also for people who are working with serious problems, whether they be psychological, such as schizophrenia, manic, bipolar manic depression, whether it be depression, anxiety disorders, anything like this, things that you've been struggling with your whole life, things that you can't get through, even to the point of things like relationship problems that you have not been able to resolve, hepatitis that you have not been able to resolve, and things like this. This course, we have had success using the Sufi spiritual healing in all of these areas, where we've had people with stage 4 cancer, prostate, breast, colon, and many other things have healed from this type of work, cervical cancer. We've had people with arrhythmias, cardiac arrhythmias, congestive heart failure, atherosclerotic disease have healed from this type of work. People with kidney failure, end-stage kidney disease have healed from this work. People with COPD and unable to breathe, on oxygen, full on oxygen, who have healed from this work. So it's very, very, very powerful work. And the way it works, and talk about it briefly how it works, is essentially it gets to the causative factors within a person that's causing the disease. Okay, so it's a very simple way of understanding it. But inside, all disease is actually a manifestation of what's inside of us. And if we can get to what is going on inside of us that is causing that disease, the consciousness, the psychology, the spirituality, the emotions, the belief systems, transform those. If we can find the cause, that's the first key. Can we really find that cause? And then secondly, can we transform it? In other words, can we find it and can we transform it? If we can do that, we can see profound healing of disease. And of course, the third piece, and perhaps really the most important piece, is if we can truly bow to the Most High, and that God sends down His order for healing and the angels for healing, then there's nothing that can be stopped from healing. So this combination of really invoking and receiving the divine support, and then being able to find and reach the core part of our being that is really manifesting that disease, and then committing to it and having the support to have a program that keeps you on task, with your healing, because you're going to be working with myself. I'm going to be there helping. We have a great team of healers that have been assembled. But you also are going to be getting personal coaching by our coach, Jamil Sontag, who is a professional coach as well, and she will be supporting you to keep on track. And I've spoken to many people. One of our people who was very, very sick for a long time could not heal, and she recently got through her illness. And I said, "What really made you get through the illness?" And she said, the issue was that I was not on task. I wasn't staying fully committed to my healing, and that was what the problem was. Once I really settled down and I had support and I stayed on task with my healing and I worked on it every day myself, no matter what, and I really kept at it, she said all the diseases disappeared. So we're going to be working with a coach to help you have that process. You're going to be working with healers each week who are going to be working with you to be able to make that healing within yourself happen. You're going to be working with me. I'll be there overseeing this whole process, working with you myself. We'll be working with group healings. We'll be assessing you month by month. You'll be working with the healers, different healers, to walk you through the process. You'll be doing group healings. So it's a very, very powerful way of healing. And how did this come about? Well, it came about through my personal experience of having worked with people for over 30 years now with spiritual healing, and what I found to be the hallmarks of what it takes to heal. In other words, here's the recipe. It's a very powerful, very simple recipe. Number one, and this is the master key, you have to be able to access into the divine and receive the divine support. So we're going to teach you how to do that, as well as every one of these healers who are on this call, who are going to be working with you. They all are very capable of doing it as well. And of course, I'll be there as well. So we're going to be first really teaching you to access into the divine, and we'll be calling forth the divine ourselves. And together with your call and our call, we're going to bring forth this divine support and the angelic support. Now, that alone, we've seen many miracles with that. In other words, when God sends the order for healing, nothing can stop it. And I remember when years ago we were healing a group up in Portland. A big group came in. We had a very strong group, and we just called to God. There was nothing more than we did. And shortly after that, a week later, a man with a massive Kaposi sarcoma on his leg, a big cancer on his leg, it disappeared literally within a week or two. It was gone. So just by calling forth to God, nothing more. There was no other work that was done. This massive tumor disappeared literally in a matter of a couple weeks. So the first thing we're going to be learning is how do we really reach to that level of calling to God and bowing to God and receiving that healing. The second master healing key is we're going to be learning how to heal across all the dimensions of self. In other words, we're going to be starting with the spirit. How do we actually heal your spirit and your soul? How do we reach to your spirit and your soul and actually heal at the highest levels of your being, at the very source of who you are? Where by the way, most life-threatening disease is happening at the soul level. If you want to heal it, you really have to get there. You have to get to the soul. The soul is trying to learn. It's working through something. If you can help it to work through it, it usually will heal. And I'll talk to you by the end of the call about how to do that. So we're going to be talking about spiritual and soul healing. We're going to talk about the heart. How do you actually heal the heart? And how do you break through all of the pain and all the hidden things in your heart that are causing illness? How do you break through it? And we're going to be talking about how to do that. And then, of course, the self. It's, what are the ego, personality issues that have caused your disease? What's operating in that? And oftentimes that's not just from ourselves. It may be coming in from others. It may be coming in from the family. It may, if you have children, very often children with disease, it's coming through the family lines. For example, if you have a child with autism, you very often, to heal autism, you have to work with the mother, the father, the grandfather, the grandmother. You have to work with the whole family. Also, we have found that very often to heal the family, we have to actually heal the parents. In other words, by healing the parents, the child will heal itself. So it's an amazing thing that the light actually jumps back and forth like that. So this program is a program that is designed to skyrocket you through healing any illness that you have, including life-threatening ones like cancer, any particular ongoing issue. Like if you have not been able to resolve something in your life and you have an anxiety disorder or difficulty with your family or your husband or your wife, this course will take that on and help you to get to the heart, the soul, the self, all the spiritual aspects of why this is not healing. And you will be held for 7 months to walk through these issues. You're going to be held for 7 months to go through it. So it has the potential to skyrocket you through whatever it is you're working with. Imagine taking 7 months to focus once and for all to finish up something that's been affecting you in your life, your whole life. 7 months of commitment, 15 healers to focus with you, group healings, ongoing assessments, to walk through it once and for all. If you have psychological illnesses, if you have, schizophrenia, we have worked with schizophrenia many times. We have a number of people who have healed themselves completely from schizophrenia. They are fully functioning, fully healed, operating in the world, holding down jobs, marriages, everything. And before they were full-on schizophrenic. We're going to help you to be able to reach that in yourself. It takes a lot of commitment, but you can do that. You can actually transform that. Manic depression. If you're somebody who has, those manic episodes where you go so far, you get so far out there, and when you're out there, you know what it's like to be in that manic, and you don't know how to get out of it. We're going to be teaching you how to get through those pieces. So this program is designed to reach to the deepest parts of your being. The reason why the diseases don't go is because you're not getting to the core. You're not getting to the core. You're not getting to the soul. You're not getting to the spirit. If you can reach to the core of your issue, and if God can come in and help you, then you will see major change in every single disease that there is. Every single disease that there is. So, again, what are some of the keys? Well, that first key is that bowing. Can you truly learn to bow to God? Can you really bow? And I know one case of breast cancer where all she really did was fully bow to the presence of God, and within 7 weeks, her cancer disappeared. It completely disappeared. She actually went in for surgery, and they did the surgery, and they sent the pathology in because there had been breast cancer that had been diagnosed, aggressive breast cancer. And when they went in, I remember she said to me, you know what? I bowed to God, and God took that tumor out of my breast. He literally reached in and took the tumor out of my breast. I knew it was gone, but I just didn't have the strength to tell the doctors. Nobody believed it. I almost couldn't believe it myself. And she went in. She had this bilateral mastectomy. They took off both breasts, I believe it was. And when they checked the pathology reports, the cancer was completely disappeared, and it had all occurred in less than 2 months, 2.5 months maybe. So this is the type of kind of healing that you're going to see with this. It's very, very possible when you have this deep bowing to God. The other thing, of course, is the group of healers. That if you have a very advanced group of healers working together, that there's an exponential quantum effect in the healing. So by having the group healings over the years have been the most powerful healing of all. And this is where we've seen people with, I remember one lady, she had COPD, she couldn't breathe, she was on oxygen, her blood tests were very, very poor, and she had a group healing, and within, I think, 7 to 10 days of that group healing, she went off the oxygen, her breathing came back, and she was completely healthy again. So again, you see the group healing is very, 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 very powerful. And in this particular group, we've assembled, I believe, a group of very, very, very excellent healers. All of these healers that we have in this group are all extremely well trained already. Most of them, I would say 95% of them have healing practices where they're working with people's significant illnesses, and have been for many of them for 10, 15, 20 years at a time. And I'll give you some of the history of some of these people, just so you know who you've got. We've got, for example, Nasir Passing, who is a Muqaddam from Florida. He's a healer and co-graduate from both the University of Spiritual Healing and Sufism, also Brennan School of Healing, has been healing for many years. We have Ruhaya Michener, who is a Muqaddam or spiritual teacher from Worcester, Mass., also a graduate, a healer, a therapist of the University of Spiritual Healing and Sufism. Amina Winslow, another Muqaddam in Massachusetts and healer. Salima Stanford, a graduate of the University of Spiritual Healing and Sufism. Bianca Aguera, who has been a physical therapist for many, many, many years and graduated from many schools, as well as Sharifa, who's a social worker, therapist, professional healer, and graduate of the Healing School. Ahmed Levine, who's a psychologist, a master teacher, and graduate of the University of Spiritual Healing and Sufism. And on and on. We have Yasmin Libman, who is a master teacher and healer with over 20 years of experience in healing. Liliana Friedlander, she's an international healer. She works overseas and in the United States and Mexico. Hamida Moriarty, who is also a USHS graduate healer, over 20 years of experience. Rahma Lang, she's director of the Mexico City Sufi community, a graduate of the University of Spiritual Healing and Sufism. Nama Rakowski, an amazingly gifted natural healer, and others. So again, there's Amina Mary, I forgot Amina, who's a doctor of osteopathy, USHS graduate and healer with over 20 years of experience. So the point of it is that there's many, many, many healers who are on the call, who will be working with you. In fact, many of the healers are actually on the call tonight listening as well. And they're going to be supporting you in this process. So I'm going to start. I want to go in and I want to talk to you. I want to actually bring out one of our patients who, her name is Heidi. And Heidi, if you would raise your hand so I can find you on the call here. And I want to talk with her a little bit about the healing that she had so that you can hear what actually happened in her process. So Heidi, are you on the call now? Because I know you were a minute ago, and now I'm not seeing you. Oh, there you are. Okay. So I'm going to go ahead and unmute you. Heidi, can you hear me?
Yep, I can hear you. Can you hear me?
Yes, I do. I hear you beautifully. So,
okay.
Heidi, what I want to do with you, I want to talk to the people. Tell the people a little bit, first a bit, about your son and what happened, was going on with your son when you called me.
Okay. When I called you, my son, I was 2 weeks overdue, and he came out. He was 10 pounds, 7 ounces, and had gotten stuck. And we don't know when he stopped breathing and everything else. One nurse had said it was the most dramatic, terrifying birth she had seen in her 20 years at this really well-known hospital.
Most terrifying, you said? Most terrifying birth?
Yeah, terrifying. Because they had gotten to the point of they were lifting me up in the air, flipping me around because his head came out, but the rest of him didn't. And we were up to the 5th. There's 6 steps they go through, and the 6th step is to push him back in and then cut you open and take him out. And we had gotten to the 5th step, and he finally came out, but he was no life signs. So 0 life signs. It took them 5 minutes to revive him, and because all the monitoring and stuff had fallen off through the process, they just didn't know how long he had been without oxygen or anything else. After they revived him, everyone in what I found out from my doula later is everyone in the room was crying because it was just so dramatic. He was given a 50-50 chance of survival, I think a 60-40 chance of, or 70-30 of brain damage, and they whisked him off to a children's hospital. And it was at that time that I called you. And we went through, he was put on a cooling cap for 3 days, and during the time where we didn't know if he was going to survive or not, we went through and we prayed the 99 names of God, and
Before we talk about that, Heidi, let me just go through a couple things. So the baby was born essentially brain dead, is that right?
No life signs whatsoever.
No life signs whatsoever. Everything was gone. And we know that for a fact that it was without life signs for more than, 5 minutes? More than 5
minutes. We don't know how much longer than that.
Right. And so from a medical perspective, 5 minutes without life signs is a major thing. Normally, when you do like CPR, usually within within 2 or 3 minutes. If you can get the CPR moving within 2 or 3 minutes, or the drowning, if you can get the CPR within 2 or 3 minutes, you have a chance of bringing him back. Usually after 5 or 6 minutes, you're probably not going to save the person. So this was a major thing that he was actually born and without oxygen and without life signs for that length of time.
Yes.
Okay, so go ahead.
So, and I had already done the self-healing course, and I had done some other courses that really, I think, helped through this whole process. So they moved him to children's, and then that's when I called you. And when my OB came in, you and I were on the phone, and you actually talked to her, and we're asking certain things, and my OB said, "How do you know all this?" Or she asked me later, "How do you know all this?" And it's funny because she came in right when you called the first time, and then she came in again a couple days later when we were going through part of the healing process.
Oh, nice.
So it was an amazing experience because so many people in the hospital, different nurses, technicians, all kinds of people were saying how miraculous this was. It was just such a miracle that he not only survived, when he came out, they broke both clavicles on either shoulder, and he also had Erb's palsy because they pulled the nerve out of his arm. And they told us that if he did survive, he would have to go back to the neurologist every 6 months until he was 18. He might not ever regain any strength in his arm. And, you know, it didn't look so good. Well, going through all of this, after the process, he was fine. So 6 months after all this happened, he was cleared from neurology. Neurology said he was fine.
Wow.
And with the Erb's palsy, we did, it was called a brachial plexus injury. He now has just recently been cleared of that. He has almost full, total functioning of his arm, and they think that he's probably going to get there. There's just one small movement that you only need if you're playing the violin. That's the only time you use that movement. And so there's just all of this amazement over how he could come from no life signs whatsoever, Erb's palsy, 2 broken clavicles, possible severe brain damage. Oh, and I want to say, when we were, right after we had finished the healing sessions, I felt this sense of peace, and I just knew that everything was going to be okay. And at that time, he was actually having an MRI, and one of the nurses said to me, "How do you know?" And I just had this incredible sense of completion. Like, we had really gotten to, because, well, just to back up 1 second, the reason why I took the self-healing classes is because I didn't want all of the genetical stuff passed down to my family. I wanted to break whatever cycle I could so that my children wouldn't have to deal with stuff. So anyway, so we're sitting there, and I felt this peace. I didn't know the results of the MRI yet. And the nurse looked at me and she said, "You've broken the generational curse. The generational curse has been broken." And she was very Christian, and she was, you know, and there's so many people praying. And then back at the hospital room, the technician came almost running in and said, "You wouldn't believe it. Your son, his brain looks as if he has gone through a normal vaginal birth." And everybody was just amazed. So
what would you say? So the real miracle here was this fact that, first of all, he was basically brain dead for over 5 minutes, no oxygen.
Mm-hmm.
They didn't know if he could recover. If he did, it was a 60 to 70% chance that he was going to have brain damage.
Yep.
Then he has the MRI. How many days later was that? 2-3 days later, right?
Yeah, that was about 3 days later. 3 days later, he had the MRI.
That his brain is absolutely completely normal.
Yep, absolutely, completely normal. And then after the observation, when they originally said you have to come in to the neurologist every 6 months until he's 18, well, we only had to go to the first appointment, and he was cleared. He was born in August and cleared in February.
So that's the real miracle right there. That's that healing in the brain, and that there was no damage and that nothing happened.
Yep.
That's the true miracle right there.
Mhm.
Yep, and the brachial plexus healing.
Yeah, and they told me with the brachial plexus, they said, there's a strong chance he might not ever use that arm again. And so how quickly his arm came back was pretty amazing.
How old is he now that they've cleared it? What's his age now?
He is he'll turn 3 in August.
Right, so
he was cleared about 2.5.
And they were expecting it to be 18 years.
Yeah.
Okay, beautiful. So would you talk to the people now? Tell them a little bit about the healing. What happened in the healing, do you think, that actually caused, this to happen?
Well, I think it was when we were praying the names of God, the 99 names, and images were coming up. All of these images were coming up from me, and then I would tell you what those images were. And then it felt like a history of things that had happened either through grandparents or parents or in my own life or my husband's life, it felt like every time we went through one of these names, all of this really deep stuff came up. So, yeah, I was having all these images, and they were like just flashes, like pictures.
Yep.
And all these pictures would come up. I would describe them. There was some input, and then finally it would get to like a clearing. It just felt, okay, we're done with that now.
How did it clear? How was it cleared?
Well, the picture would flash, and I think from what I recall, it felt like just a really strong image, and then that picture would dissipate, and I would feel a lightness, and I would feel like this tingling all over, and this real sense of relief, kind of like if you feel a wave come over you. So it was like a wave, a cleansing wave that just went through my entire being, and then there was a certain kind of peace. And then the next one would come up, and the images again, and it was just continuing to go through those waves of different experiences.
Did you feel like you were like funneling down into it, like you were going deeper and deeper, or did you feel like you started at the bottom and came up through them? What would you say about those images?
I think it was a little bit of both, because at times it felt like I was going. It was like there were so many layers, and sometimes it depended on the issue. Like sometimes it felt as if I was going deeper and deeper and deeper into the root of what initially caused the issue.
Mm-hmm.
Like even farther down my lineage. I felt like I was going deeper and deeper and discovering how that thing was carried on from person to person. So starting here and going backwards. And then there were also times, I think, where I maybe felt a little unsure, especially if it was something that I felt that I was the main guilty force there. If it was something in my soul level, I think if I was a little unsure, it started as that kind of went the other way. Like, here's what's happening, and here's how I don't know if it's clearing the future or if it's a cleansing. It was like that was being washed.
I see.
If that makes sense.
That makes sense. And it was washed out. So can you give the group an example of something like what was maybe the most profound set of images that you cleared or came up, or which quality which one do you most remember, and maybe the images with it, for example?
And is it Nur? N-U-R?
Mm-hmm.
That one was, now I feel really light about it, but there was such a darkness, and there was images of people who had really done horrible things to each other. Really just dark, nasty things that I didn't even want to, I wouldn't want to see.
Mm-hmm.
And kind of this invasiveness. And going deep into that, I think is what, that was just amazing. And then I also had these images that didn't seem like they would relate anyway to my life whatsoever, but I had some of a Mayan civilization and kind of the violence that went around that. And I know that I had visited a temple not too long before that. So it was almost, in these images, it was like watching a movie.
What do you think, how do you think that, here you are clearing the images that came up, each quality, like Nur is divine light. They're bringing up, divine light, for example, would illuminate very deep, hidden aspects of self, which is what happened in this case, really, like violence and, very serious things that you were carrying in your subconscious. How do you think that transferred to your child? How do you think this healed him?
Well, at one point, I think you said he's been given a clean slate. And I just felt like he really had been given a clean slate. I really felt, and I still feel, like he won't have to carry on all of the dark, deep things that were genetically or, you know, spiritually passed on.
I see.
He's just an amazing. He's an amazing kid. Has an incredible vocabulary. He's so well balanced, and all of the physical therapists and everyone who has worked with him have just been really, really amazed. So it feels so much lighter. I don't have that worry.
How's his IQ? I mean, how's his IQ turn out? Is he smart?
Oh, he's super smart. He is really intelligent. For example, a 1-year-old doesn't usually say, "Well, actually, I think this." You know? So he's using words, and he's complete sentences, and he has been since he was probably around 1 or so. He's very observant. He's also pretty kind and gentle and loving, and he's very kind with all kinds of people. He doesn't seem to he also seems bold and strong. Of course he's 2 going on 3, so you know everyone who's worked with him, especially all of the physical therapists and things, they're saying, "Oh, I don't see any need to worry."
Nice.
From where we started to where we are now, they just can hardly believe it.
Amazing. So I'm going to open any lines. If anybody who's on the call would like to ask Heidi any questions about the healing or about the child or about what happened, you can star 2. If you push a star 2, you can ask her any questions. So I'll give it a moment, see if anybody has any questions for her. What I'm trying to explain to you is that if you really think about what happened here, I mean, here's a child who's essentially born dead. You know, major, serious, birth problem, and the kind of stuff that you pray as a mother that you never have to face. So it happens. Here Heidi has to face it. And then she has the courage, and she goes inside of herself, and she says, look, I think that if somehow I can get into this and clear what's inside of this, inside of myself, inside of him, inside of the family line, that he might heal. And so she calls me up. It was a Sunday, if I remember. She said, I need an emergency session. I think we spent, 3-4 hours on the phone?
Yeah.
It was like 3 or 4 hours straight. And we went through the 99 names of God. So we went through Ar-Rahman, the compassionate, Ar-Rahim, the merciful, Malik, the sovereign Lord, Al-Qudus, the most holy. And each of these names, as we would recite the names and bring them in, they would trigger these subconscious images in her psyche, in her mind, and her heart, her body, also in her lineage. In other words, she would have memories of that
wars.
Wars, right? That were being kind of passed to your grandparents, right?
Yeah, or great-grandparents even.
Yes, and somehow those memories were still being carried in her subconscious. And each time she released it, the memory would go, the image would go, she would lighten up, but something would also transfer to the child. In other words, not only was she healing herself and her lineage, but there was a transfer of the healing to the child as well, and something would shift inside the child.
Mm-hmm.
See? So, and then this concept of layers, that each quality, there were often many images per quality, right? It wasn't that it was only one image per quality, right, Heidi?
Right. There was lots of images. In fact, we actually would break, and then we had another couple days of sessions because it was just so many images. There was so much that came up.
You can see this concept of layers, okay? So in healing, every disease has it's a complex creation. It comes from, in essence, images that veil these qualities. Okay, so for example, Ar-Rahman is compassion. Compassion may have 10 different images, both from yourself, from your parents, from your genetic line, from, who knows where you pick it up. You could have picked it up from somebody else. You could have picked it up from being intimate with another person. You could have picked it up from, there's all different ways. Sometimes it just gets passed, it gets transmitted. So even from the TV and things like this. So these images are in and they veil the compassion. So there are diseases that are reflections of lack of compassion. For example, hepatitis is a very classical one that has to do with compassion. Okay, so by bringing in these qualities, Ar-Rahman, and then sending it forward, and then allowing it to go deep, deep inside, it triggers these hidden things. And then using the system of healing, the spiritual healing that Sufis learn, then we're able to go in and wipe those images out of the person. And each time you wipe the image out, there is a clearing of light, and there is a subtle decrease in the intensity of the disease. So, for example, if you have cancer, let's say you have 99 names, let's say that each name has 10 images. You may have close to 1,000 images that are actually behind that creation of cancer. Okay, and if you can get in and you can, using the light of God, see, everything is done from the light of God. We call to God, we actually access these names of God, which are expressions of the divine reality, and they go in and they actually clear these veils of the divine inside of you. Then, when it's done, there's a healing light that's come in. For example, when you use Nur, Heidi, and when we call to divine light, and it brought through the clearing of those images, when you were done, was there more divine light after you cleared the veil?
Oh, absolutely. Absolutely. It's, yeah. It's kind of like looking at beautiful clouds in the sky,
And before that, it was not so beautiful. It was much more stormy, right?
Oh, yeah.
Yeah. So again, everybody, when you're trying to heal, like if you have, let's say you have schizophrenia, or you have cancer, or you have MS, or you have anything like this, you have many veils that are layered. I call these the onion layers. You have many onion layers that are veils that have veiled these qualities. So you're not expressing, Ar-Rahman, compassion. You're veiling Ar-Rahman. And what it does is it causes like an abnormal energetic or an abnormal spin or an abnormal energetic phenomena within your system. Your electromagnetic fields are not operating correctly. And what that does is it actually causes some type of physical damage in the body. But the beauty of it is, if you can change those veils, unveil the qualities so the real compassion shows up the way you're supposed to be, full-on compassionate, then as that compassion opens, the vibration in the body returns to normal or even better than normal, and then everything in the body can click in to heal that place. You see, it's because of the veiling that things didn't work. Once the veils are released and the natural quality is brought in, Ar-Rahman or Ar-Rahim, mercy, then all of a sudden the divine light is there, the electromagnetic, the genetic, transcription of the DNA and the RNA, everything begins to come forward. Now, we're still working this all out, and this is all still being explored in traditional medicine. But what we can say is that by changing these veils, the light inside the person changes. As the light inside the person changes, this miraculous healing occurs. And this is only done when we're working with the 99 names of God, and it's God's light doing the healing, and we're returning the person back to an expression of the divine that they're meant to carry. In other words, they're meant to carry true compassion, not human compassion, but really to carry compassion in the way that God would carry compassion, Ar-Rahman. God is the compassionate one. So when you heal the place, well, I'm not going to be compassionate because I'm angry, or I'm not going to be compassionate because, my grandmother got hurt 3 generations back and I don't know what compassion is, or I'm not going to be compassionate because my mother wasn't compassionate. I have no idea what compassion is. When you heal those images and memories inside of you and they release, that was my mother and she wasn't able to love me and she was very hard on me, so I was very hard and I stopped being compassionate. When you release that, the light of Ar-Rahman unveils itself and compassion comes in. Then you go funnel deeper. The next quality shows up, or the next image shows up. Oh, wait a minute, now there was something even deeper. I see where my mother was not compassionate because her grandma was very hard on her. And you see, it's like you'll actually remember it. The images are somehow transferred in the psychological nature of the being. And I see, my grandmother was really hard on my mom. And you clear that. And then all of a sudden you go back again and you say, this is what happened. There was this war, World War I, or there was a war somewhere, and the great-great-grandmother, she lost everything, and she didn't believe compassion existed, and she became hard inside. And this is where it started. And then you clear that image. So there's this cycling of images through time and space. And this healing, it profoundly opens those qualities. And when all 99 qualities are worked through in an individual, in the body level, the ego self level, the heart love level, the soul, and the 99 names, and even into the spiritual world, this is where we see this miraculous healing occurs. It has to go through all 99 names and all the veil in relationship just to that disease. So if you have cancer, you're going to have to work through the veils that are related to that specific disease of cancer. You see, now you might have arthritis, and there may be different, you may get the arthritis by doing it, but you may not. That may be a different set of veils that cause that arthritis to come out, you see. So that's how the process works. Heidi, do you want to say anything else about it before we go on to our next one?
I would say that it really helped that my husband had a healing session before I called you, because it's hard to believe unless you've actually experienced one of these sessions. It's hard to believe unless you've actually walked through a healing. And it's amazing and profound at how much can change just by going through these names.
Beautiful. All right, Heidi, thank you very much. I don't know if you can stay on the call or not. I might want to come back to you, but I know you might have to go today, so up to you. But if you'd like to stay, you're welcome. We'd love to. We may hear more from you, okay?
Okay, thanks.
Okay, very good. All right, I'm just going to leave you open, so you might want to mute your side of the phone, just in case there's noise there, okay? All right, now I'm going to talk, again, in this course, in the patient healing, or what we call the Breakthrough to Healing program, what we're going to be doing is you're going to be working with being able to go through these 99 names and the veils with these healers, and I'll be there to guide it. In other words, I'll be working to bring up the veils and helping you to find them, and then these 15 healers will be helping you to transform them, along with myself. We'll be transforming these at a very fast rate. You're going to be spending essentially 7 months learning how to get to all of these 99 veils, all these 99 names, all of the veils related to your illness, clearing them, and then not only clearing them, but then beautifying yourself with the divine name. So you're going to really carry compassion and mercy, and then you're going to go forward with your life where you actualize it, where you move forward. It becomes part of who you are. So in other words, you don't go back. There's no going back. There's no going back because there's nothing to go back to. You're going forward, and you're going to carry that in that way. And this, by the way, this same process works with many things in your life. For example, if you're having trouble with work or success in your life, the same process will have dramatic effects in shifting those realities as well. So they really shift in many ways. But let's go on. We're going to talk again. I want to open up another one. Barb, I know you're out there somewhere. Would you star to your hand? This is another lady who attended one of our courses, one of the self-healing mentorship courses. It was a 7-week course where she was working. She came in, was very sick with congestive heart failure, and worked for, this is our very basic self-healing level 1, nothing like this master's course, which is our highest level course. And she was assigned a healer in that class, and she worked together with that healer, and of course with me as well. And we'll talk to her about what happened with her healing process. Barb, are you out there?
I am. Did you see my hand?
Yeah, there it is. Yeah, I finally found you.
Okay.
Okay. So, Barb, would you tell the group what you were diagnosed with?
I was diagnosed with congestive heart failure, and how that came about, I was 56 years old. I had a heart attack out of the blue, and it turned out that my heart had been damaged at some point in my life by a virus, enlarged so it couldn't pump strongly enough. So blood pooled in my heart and formed a clot, and the clot broke off, and that's what caused the heart attack. And they call that congestive heart failure, where your heart is damaged. They call it a viral cardiomyopathy, which means they don't know really exactly what caused it. But it was a virus at some point damaged my heart.
So did you have the congestive heart failure before the heart attack, or did the congestive heart failure happen after the heart attack?
I knew once I had it, I realized probably for 2 or 3 months before I was more worn out, more breathless. Now that I knew what it was probably because my heart wasn't pumping strongly enough, and maybe the clot was forming, I don't know. But no, it was the clot actually, when it broke off, it exited my heart and caused damage in the lower part of my heart on the outside also. So there were 2 things. There was the actual damage from the clot heart attack, and there was a congestive heart failure that was a weakened heart from a virus.
Got it. Okay.
That nobody ever knew about. I mean,
right. Now you went to the hospital. You were seen in a hospital, right?
Yes.
And they did all the testing on you. Is that true?
Yes. Yes. It was one of those where I actually was in the room in the emergency room, the full-on heart attack. I mean, we got to the emergency room. I walked in and said, "It's my heart. Help me now. You know, it's my chest." And I mean, the room was full of people standing there with paddles. A lady came and stood by my shoulder and said, "You know, have you done one of those things about your medical preferences?" You know, and I said no. And I can't remember what she asked me. I said, "I have to stay alive. My children still need me."
Right. So was that serious? You were close to dying in that moment.
They were prepared to handle that.
Yeah, got it. So you had the heart attack. It went into one of the ventricles, right?
Oh, I forget the word. It was the pumping. It was either the left or the right part of your heart that pumps.
Right. Okay. That's the ventricle. Yeah.
Okay.
Okay. So went to the ventricle, and the heart. It was a major heart attack, right?
I would assume.
Yeah. Okay. So a major heart attack means a full vessel occlusion. So they have.
I don't know. I'm not sure it was that, but it was damage. My husband said that they actually told him that at first, well, no, it wasn't a heart attack. It took a little bit of time for those enzymes that show up.
Right.
To show up so they could say, yes, that was a heart attack.
Okay, so you had a heart attack. The enzymes showed up. When there's a heart attack, there are enzymes released by the tissue that dies. So when you have a heart attack, you have a clot. It blocks the artery. There's no oxygen delivered to the myocardium, the heart muscle. The heart muscle dies, it releases a series of enzymes, and that's how they measure whether or not you've had a heart attack by those enzymes.
Yeah.
Okay, so you had enzymes, which shows that you definitely did have a heart attack.
Yes, and that it did actually damage a specific portion of my heart.
Got it. Okay, perfect. Okay, and then how much after the heart attack did you go into congestive heart failure? When did your heart actually begin to fail?
I don't know. They call it that. My heart function at the time, my ejection fraction, which is how they measure the amount of pumping your heart is doing, a normal ejection fraction is 55 to 70. Mine was 22 to 25%.
Right.
Which means my
go ahead. Mm-hmm.
Which means my heart was only pumping about a third as strongly as an undamaged heart would.
Exactly. And it was also very enlarged. When you have congestive heart failure, your heart becomes very big. It doesn't work properly. So in this case, she's at 22%. 22% is considered basically, you don't go much lower than that. How much time, when you hit 22% and you were on all the drugs and everything else that they were giving you, what did they tell you about life expectancy at that point?
They didn't. They did tell me, I mean, even the next days they did all sorts of tests. They were going in expecting to find like all kinds of blockages and putting stents in and all this kind of stuff. And there was no buildup in my arteries at all. They assumed this was that my heart had been enlarged before, and so there wasn't, they did tell me, 2 different doctors told me that they were referring me to the big medical center in the big urban area 2 hours away, the biggest medical center in our state, to be sure I was being followed by them, and they wanted me to get in their system in case I ever needed a heart transplant.
Got it. Okay. All right. So everybody, just so you know, congestive heart failure, is a big thing. Essentially, the ventricles don't pump properly. It's like a pump. As she said, 55% above is normal ejection fraction. 40% and above is considered, at 40% you don't do much. If it hits 40%, once you drop below 40%, you have to go on significant medications, things that support the heart pumping. And at 22%, that's usually about as low as it goes. Shortly, you're not going to get much lower than that and be able to continue, with survival. So she was at 22% when she called me. As a physician, I didn't say anything about that at the time, but she was very, very serious. That's about, you're not going to go much further. There's not really much more you can do at that point from a medical point of view. Now, she got on and she worked very hard because she knew, when you called, you knew you were putting everything into healing this at that point for your kids, right?
Yes, it was after the doctors, it was about maybe 2 or 3 months after, because it takes a while to recover, and they put you on the medicines, and I can't remember if I talked to you before or after, but then they retested my heart, and I remember when I went in and the doctor said, well, this is it. Now all you can do is manage this, And I was like, no, I'm supposed to have gotten better because you might improve a little bit after you have it. And that's when I called you. Maybe I started talking to you a little bit before then, but it was then that you looked in my heart and saw the virus. The doctors had told me there was nothing they could, the virus was a long time ago. It was gone. It was out of my body. And you could see the virus in my heart and said, we've got to kill that virus, and put me on a intense antiviral diet for 6 to 7 weeks. And you also said, we've got to find out what broke your heart. And let me see. And I knew to call you because I'd listened to a couple of beginning telecalls, and and then, let me see, I'm trying to, and when you said we have to find out what broke your heart, I mean, I knew I had a very abusive childhood. I mean, Heidi's story was just so amazing to me. I'd never heard it before, and things came down in my lineage that were horrible that parents did to kids. And I knew that my childhood was very sad, very hopeless, very terrified. And then I signed up for that self-healing mentorship class. You were just starting it then, so it was a great thing for me to get into. And I had some amazing experiences and healings with that. I remember I was one of the people that you called on in one of the first calls and worked with individually for the class as an example. And it came out that I had no trust. I'd given up on God. I mean, when I was really, really young, I didn't believe that anything or anybody would ever help me. And I remember when you prayed the qualities over me, and then it was like so amazing. I said, I have to tell you what's going on. It's like I feel so forgiven, and the prayer was turn back to God. Yeah, and it was like I just felt so loved and so forgiven, and it was like God was just smiling at me and saying, you really thought life was supposed to be this? No, don't you get it? I'm here to help you. It was amazing. And then I also, when I started working with my buddy, so I was on the calls every week, and I was also working with my buddy healer, and she was much more, and people were buddied up at that point. I didn't realize at that point I was probably one of the least trained, experienced person in this kind of work at all, whereas my buddy had been healing and was much more experienced. And I was so blessed that was the name that God gave you to make my partner. And what the biggest healing was over my grandfather, who had sexually molested me, and we're sure my mother, and we're sure this was probably coming down through generations. And it was, and I can't remember how it came about, what the prayers were, what was happening, but I saw this young boy, like 6 years old maybe 5, maybe 7, and he had blonde hair, and he was standing in a field, and the wind was ruffling his hair, and he was dressed in garb of like maybe the 19-teens. And I knew it was my grandfather. That made sense. My mom was born in 1935. And there was some rolling hills a little bit behind him. He grew up in North Dakota, and that little boy was so incredibly happy. He was just shining with the happiness of a little kid, and I loved him so much. There was this incredible love that went almost like a tractor beam from my heart out to him and surrounded him. He was just amazing. And I knew that was him before somebody hurt him really, really, really badly. And I'd been in all of my sisters and I, my brother, we all tried psychology. We have struggled our entire adulthoods to overcome what happened to us as children. And I remember one Christian counselor I'd gone to about this issue, and she said, well, you have to love him. You have to, forgive him and love him. And she never said, though, love him like he was an innocent child before he did all that stuff. And I couldn't figure out how to love him. You know, I tried for years to figure that out. But so this little boy was there, and he was just so happy. And then he kept coming back. I mean, I could close my eyes and see him, and this incredible love just poured to him over a period of days. And then we had our next call, and I was like, well, Ibrahim, this is what is happening to me, and is that, like, weird? I mean, I'm becoming fixated on this, you know, and what, and then gradually over the next day or two, it became less dominant, and then I saw him, and I knew it was goodbye. Just the way he looked at me, and in that experience, he was in the field, and he was looking at me, and he smiled. He didn't say any words to me, and he turned to the side and walked off across the field to my left. And as he was walking across the field, he was growing up and becoming, by the time he got to the side of the field, he was like a young adult man. And he turned around and looked at me and kind of nodded goodbye, and I could see thank you in his eyes. And then he walked off.
So Barb,
Do
you think this was the key moment? Do you think this was the key moment when the broken heart healed?
Yes. I think it was the start of it. I think it unstopped the dam, because things happened. Then not long after that, there was a time where I was working with my buddy, and we were talking and, you know, trying to see in my heart and try and get images and try and go back to the core and try and, you know, and the inside of my chest was all dark. And and then we were praying, and these arrows of light came from the side and brushed the top of my skin, almost like when they put an IV needle in or something, you know, and it just goes in along your skin kind of. But these arrows were shooting into my chest and like exploding like fireworks, not explosion-y things, but magical lights going all around and filling up my whole chest. So light was there.
Beautiful. So the light came in, the darkness went out, the memories went out, the love came back, the forgiveness came back.
Yeah.
And then when you went for your test, how many weeks or months later was it when you went for your test?
It was, I wanted to because I'd worked with this class and I'd done the viral thing, and then there was a time when you worked with me individually also. It was, I think it was personally with me. I'm not sure if you were on a call with me and my buddy. I don't think it was in front of the class, but it was like I'd progressed so far, and you were praying to help me finally get there. And you were praying, and you prayed the 99 qualities over me, and you were praying them and praying and asking God to help me. And I tried so hard to change myself, you know, to follow the path of this kind of healing. And you said, I can see it. And you could see the bottom side of my heart there that had been damaged by the clot breaking off and falling away. And I'm not sure if that's in the air. And I could feel my heart shrinking when you did that, tightening up. And then I was really determined with them that I wanted my heart tested. This was all through the midsummer to late fall-ish that all this was going on, or till September then I went to the, it was actually about mid to late September that I had that call with you, and you saw that part of my heart break away. And I felt much, much stronger. I was able to walk around. I was able to, I wasn't breathless. I could, I remember it was 3 or 4 days later, I went to see CD speak in Portland, and I was able to go up the hill into the garden and gather vegetables. I was able to help in the kitchen, which was a lot more energy than I'd had. And I was determined. I really wanted them to retest my heart then and see. And they said, well, yeah, we could probably, that makes sense. So it was like in November, they tested my heart again, and my ejection fraction was 40.
Beautiful. So 40, by the way, everybody, is essentially normal. Once you hit 40, you don't need to really see the doctors anymore.
Yeah, and they and my heart was also a tiny bit less big. It still isn't totally, brought back. But so, and then after that, I went to my next appointment. Then I had an appointment in December with the big medical center. And I had told them, I had seen them once since I'd talked with you and was talking about that I was doing spiritual healing coursework, and that I had done the viral diet, and the doctor she was very glad that I was trying everything, and then when I went back in December and she had the results of my test, she started crying with joy and said that I didn't have to come back and see her anymore. I still see, and I see a cardiologist locally like once every 6 months or a year-ish kind of, but that's...
And Barb, would you say, so that whole process was what, 5, 6 months, or what was the time for that?
No, the whole process was, I'm trying to think of when I felt strong enough to actually, I think it was from June or July of that year to September when you talked with me and saw my heart break away. And then it was like I had, or maybe it was October. And then it had the 2 month, there was like about a month later I had the test, and about a month later I saw the doctor.
Right. So really, probably the healing happened in 3 or 4 months.
Yes. Yeah. And also when you have an ejection fraction as low as I did, 22 to 25, they put in they implanted a personal defibrillator in my chest.
Oh.
That's how bad it is, so that if I ever had a heart attack, it would shock me back to life.
Oh. Amazing.
Yeah.
Amazing.
I am so glad that my sister saw you speak one time and introduced us all to your work.
Thank you. Okay, everybody, you hear the power of the healing. This is what I wanted to say to you, that this is how it works. And again, just, if you listen to Barb's story, Heidi's story, they got deep inside of themselves, what I call the interior. They get to what's hidden inside themselves. In Barb's case, she got to the issue with her grandpa and the forgiveness and the love for what had happened, and the love came in, she healed him. She had the other healings, that final piece, the prayers, that light in the heart broke away. She felt the heart shrinking up, and all of a sudden her ejection fraction goes back up to relative normal, 40%, which is, by doctors, is basically normal. So, in Heidi's case, she's funneling down layer by layer. She's going through generations. These issues are coming up each time it comes up. It lightens up. And then next thing you know, the child, is starting to do better. He's coming off the cold blanket, the cold therapy for his head. He goes in for his MRI, and all of a sudden the brain appears normal. Everything has come to normal. So, there are many, many cases like this. We have many, many stories. In our next class, we'll be talking about this on the 22nd. We're going to go into another free call about this, where we'll be having some other people talk about their experiences as well. So if you are sick, if you feel that you would like to get to the root once and for all, get to what's really causing your illness. I mean, look at this. These are people with major illnesses that have healed. If you have illness and you'd like to heal and get to the root of it once and for all, get to all these veils and release them. Like this veil was a veil of love for Barb, the al-Wadud. Wadud is the quality of divine love. She got hurt, so her heart had been so hurt by what happened as her child, but particularly with her grandpa. When she was able to forgive him and love him, and then the al-Wadud opened and she felt that love pouring through her, she had unveiled Wadud. So, so this deepening and the unveiling of those qualities, that's the healing. When she opened the love and the love poured through, al-Wadud was reestablished and grew. When she forgave, al-Ghafur, the forgiving aspect of divinity, the all-forgiving, al-Ghafur, G-H-A-F-U-R, unveiled itself, al-Ghafur, al-Wadud. These qualities came back in her heart. They expanded in her heart, and the expansion of those qualities somehow magnificently causes the body to heal. The body no longer is carrying the pain, the emotional pain, the psychological pain goes out. It triggers something deep in the healing process, and the healing process changes, and the body is then able to resolve itself, and it returns to a normal stasis. It comes back into normality. And I have my ideas about how that happens. I won't go into that in this call, but essentially it's all you need to know. So if you are sick, or you know somebody who's sick, or somebody with major disease or issues that they just haven't been able to resolve, and they want to get to the bottom of it, really get to these core places, have these prayers done, which call forth. Remember how she said the prayers were done, and that the light came in, and then the heart, this piece of darkness in the heart broke off, and then she could feel the heart literally shrink up inside her chest. It's that type of thing. The prayers will be done for you, by myself, by the group, by the healers in the group, which call forth God's help, and hopefully the angels come down and cause that breaking off of that darkness in the heart. That's from the angels. That's what's causing that. It's come God's order to make that happen. And when that opens and heals and the shift happens, that's when the disease miraculously disappears. It's this type of work. And we've seen this for me, 30 years now with every possible disease as a doctor that I can imagine. I've seen healing, major healing through this type of work. So I hope you'll join us, and please, if you have an issue, please think about enrolling in this course and joining us for the Breakthrough to Healing. We have a special offer for you, maybe to help you jump in. If you call, you can speak with our office, Jamila Sontag. She's our enrollment coordinator, and she can assess if you're a candidate for this program. If you are, and we feel that you are, we will give you, I'll do a free 20-minute consultation with you to really look at what are the possibilities for you. We'll assess your disease. We'll take a look at maybe some of the qualities that are veiled for you and what the hidden issues are for you, and that will be given to you if you are a possible candidate. So call, and you can call the 888-2-Dr. Jaffe, 888-2, 2, Dr. Jaffe, D-R-J-A-F-F-E, and see if you are a person who would be, a candidate for this course. So again, I want to thank all of you very, very much for being on the call tonight and just listening to the healings. And if there's any questions, by the way, this course is going to begin August 25th. It begins August 25th. And it's going to be happening out at a hot springs. We're going to be doing it at Norwich Hot Springs in Norwich, Connecticut. And so you'll have a week of in-person work with me and the group. You'll be at the hot spring, so you'll get to be soaking. It's supposed to be a very, very deeply healing hot spring, so the water has been very helpful for people to heal. You'll be getting very good food. We're going to be having a very special menu for you. You'll be getting good food as well, and there'll be restaurants and things in the area that you can go to that have all been chosen for you that you can interact with. So you'll be getting let me tell you what you'll be getting. You'll be getting 2 6-day personal healing intensives with myself and the group of 15 healers. That's August 25th and in January of 2016. You'll be getting monthly assessments where you'll be getting, we'll be working with you, checking in every month, once a month, sometimes twice a month, to really look at your process and what you need. You'll be getting individual healing sessions from the healers every week. You'll be getting healing sessions from 1 or more healers. You'll be getting that throughout the program, or through most weeks. You'll be getting 20 individual healing sessions through that process. And you'll be getting 10 interactive intercession group teachings with myself as well. And this is a really great thing, you'll be getting a bi-monthly coaching call from Janila Sontag, where she will be supporting you to stay on track and really get to your goals of complete healing. That is invaluable. In other words, we know that many reasons why people don't heal is they don't stay on track, and they don't do the self-healing work and what's needed. And Jamila will help you to stay on track and reach your goals. And that's all included in this process. So it should be a phenomenal group. I think it will reach to the deepest parts of your soul, like we heard in Barb's case and in Heidi's case. You're going to be working with an amazing group of healers who have really shown just the level of healing. They are all accomplished, very accomplished healers, and they will help you to reach to levels of your being that you haven't known. And we'll also be doing that group healing as well. So there's a lot going on. You'll be learning to self-heal so that when you go home, you're going to be working on yourself literally every day. What are you going to be doing? Well, you're going to be going after these veils, and you're going to be clearing those places out of yourself, and we'll be supporting you with it. So if there's any questions, please, we have a couple minutes left, so if anybody'd like to start to their hand, if you have any questions about the program, about the healing, please start to at this time, and I'll be happy to take any last questions. So anybody start to, if you'd like to know anything. Don't be shy. Jump in there, ask any question that you might have. We're happy to hear from you. You seem to be being a very shy group tonight, and I'll give it another moment to see if anybody does want to jump in there. All right. Oh, there we go. Okay, now we got some hands up here. Okay, this is from San Mateo, 6228. You are open. Can you hear me?
Yes, salam alaikum.
Alaikum salam.
I was just wondering if the price includes the hot springs, or is that a separate cost as well?
The cost is separate. I'm not exactly sure what the cost for the rooms are. I think it's reasonable, and if you do a double occupancy, I think it's maybe like $75 a night or something like that, $65 a night, something along that line.
So just for the rooms, not for anything else other than.
Yeah, the cost for the food and the rooms are additional. This is for the program, and then the cost for the room and board is separate.
Okay, great. Room and board separate. All right, good to know. And there's another retreat as well.
Yeah, there's a second. That will be in January. We're still deciding where. We want to see how this Norwood Center works out, and if it works out, we're going to come back there. If not, we may go someplace else.
Oh, is there kind of a ballpark range of the lowest cost to the highest cost for the hot springs? Like in terms of let's say you did the shared room and you did the, maybe cheaper meal plan if that's available, a certain low end to a high end, sort of like.
You know what, let me have you speak with Jamila Sontag. Give her a call at 888-2-Dr. Jaffe. She's got all those details, which I actually don't have. Yeah. And but I think, I actually don't have those numbers for you right now. So if you could call her, or anybody who's interested, call her at 888-2-Dr. Jaffe. She can go over that with you, okay?
Great. Thank you so much.
You're very welcome. Thank you. Okay, we have another one here. This is from, let's see here. Just a second. My computer is rebooting itself. This is from Irvine, California. Hold on just a second. My computer just shut me out of that screen. Give me 1 second. There we go. Irvine, California, 9555. You're open. Can you hear me? Oh, I'm sorry. It looks like, okay, let's try this again. Looks like it opened up a different one. Okay, 9555. You can speak now. I should be able to hear you.
You can hear me?
Yep, there you are. Gotcha.
Okay. I had a question regarding healing for the spirit and the soul.
Yes.
You mentioned you were going to talk a little bit about that, but we didn't get a chance to. So.
Yeah, when you use these qualities, the qualities actually can go all the way to the spiritual levels and the soul and the spiritual level. So if you recite the qualities on your own, they reach into basically the level of consciousness that you're capable of accessing on your own. But when you work with healers who have the ability to witness and reach into the soul or spiritual levels, then it really triggers and allows those levels to open so that you get to the really core level, like the lineage levels and those type of things. So that's the spiritual level, is the accessing into the soul to heal these 99 names at these very subtle levels and finding these are like the core veils that happen often in the womb, right after birth, in the first 3 years of life, and sometimes lineage-wise being passed down. I don't know, maybe it comes in through the milk, I'm not sure, but they get passed down generation by generation. Okay? Yeah. Okay, thank you for that question.
Thank you. Thank you.
Okay, our next question, our next caller is from La Jolla, California, 6039, and I think you are open. Can you hear me?
Can you hear me?
Yep, there you are. Gotcha.
Oh. Hello. Hi, this is David. I'm here with Suzanne, and she has been listening intently to this whole call and taking in the vibrations.
Yes.
And the feelings and the information. And Suzanne, did you have a question? Suzanne?
Yes.
Yes. Go ahead.
Susan, did you have a question for us?
Yes. I had what was called a stroke.
Yes.
And I was told that I have
David, could you help translate that a little bit? We're having a little trouble catching it on this side.
You had a stroke and you were told that you had, what's your question? Do you remember your question? We were talking about healing.
Yeah.
Opening up to the happiness and talking to your pain about the things that happened a long time ago when you were a little girl.
Yes. Yeah. This work could be deeply helpful for you, Susan. In a stroke, you know a stroke is there's a blood clot that blocked off the brain and caused death of some of the tissue. It's very similar to what Barb had in her heart, except you had it in your brain. And what happens is that where that blood clot glows is the place where the wounding in your brain is. In other words, where you got hurt by the beliefs, the thoughts, the memories. That's where the blood clot will actually hit that place, and it knocks it out, which in some ways is good because it helps to resolve it. But in another way, it causes all the problems that come with a stroke, the loss of movement and so forth, loss of speech and if you can get in there and you can release these veils and these qualities, I think you will be amazed at how fast you will heal and the level of resolution that will happen inside you emotionally, how much better you'll feel, spiritually, how much better you'll feel. And if we can get all that stuff out of your brain where that clot went, where all those veils are, we have seen people with, even early on, like initially where it looked like a stroke, they've done work like this, and it seems like it turned into a TIA, a transient ischemic attack. Maybe it was a stroke, maybe it wasn't. We've seen people with strokes where they have seen there's like a black, dark energy, light right where the stroke is. They've healed that, and they have had very, very rapid healing from their stroke as well. So I think this kind of work would be extremely beneficial for you if you decided to take it. Okay, and again, even if you can't get there, please learn the process and do it where you are. Okay.
Yes.
Okay. Thank you. Okay. Thank you, Susan. Very nice to talk with you.
Yes. God bless.
Thank you. Okay, I think we've got time for maybe one or two more, just out of curiosity. We have quite a few hands up here. This one is from Hagerstown, 4743. You are open. Go ahead.
Hi, Ibrahim. It's Amina Janice.
Hi, Amina. How are you?
Okay. Okay. I actually have a session scheduled with you tomorrow.
Oh, great. Good.
Maybe you can help me decide if this program is for me. I guess that's really my question. I've been getting sicker and sicker over the last few years.
Do you have a diagnosis for what's happened with you? Do you know what's causing it?
It's just vague at this point. Autoimmune, adrenal fatigue, possibly copper toxicity. It's just kind of not sure yet.
Right. Yeah, I'm sure this work would help you, but I think we got to get to the root of it. When I'm looking deep inside of you, there's either it's either a toxin or a virus. I'm not sure which it is, but there's something I think in there that's causing the problem. We can get to the root. Like if you have a virus, let's say you have Lyme disease or something like that. Lyme disease is a spirochete, very common where you are, but behind the Lymes are these veils, and if you can get the veils out and handle the issues, the Lyme disease will disappear. It won't stay in your body. That's the key for us. We've got to get to that and find what that is for you.
One other question. Can you bring your spouse to this program?
Yeah, of course. Of course. Why not? Of course. Okay.
Because that might be part of the problem.
That might be part of the problem. Yeah, feel free to bring them. We'd love to have them, okay?
Yeah, okay. Well, I will talk to you tomorrow. Thank you so much.
Okay, you're very welcome. Okay, good. Right. Thank you very much. Assalamu alaikum. Okay, good. So that was a very interesting piece there with the spouse. Okay, so I also see hand up, Jamila Sontag, who is our program coordinator, has her hand up, so let me open her up here. Jamila, did you want to say anything to the group?
I did before. I just wanted to tell them what you already told them, which is to call me about the prices and all that, and I will be glad to give them all the details. And I really look forward to talking to everybody and to support them by doing some really nice coaching work with them.
Yeah, we look forward to it. Thank you, Jamila. Okay, I think we have time for maybe one more question, and then we'll go ahead and close up. I know we're a little bit over time already here. So this is from Santa Clarita, California, 3353. You're open. Go ahead.
Hi, it's Marianne Curzon on a different phone call. We did a lot of healing work with my mom, and I feel much relieved and much happier, and She fell a couple times, 187 herself, so I was worried I wouldn't have time to heal with her, but it's you know, I'm getting there. But I unfortunately just with family moves and stuff missed the first and the third classes, and I can call Jamila tomorrow, but of this session. So how do I get 99 names, or just do I ask her? There was a book that you mentioned on the course.
Yeah. You can Google them. I mean, you can Google the 99 names. They're on the website. Google 99 Names of God. And we have a book from Citi called The Meaning of the 99 Names, which you can order from the SufiCenter.org. So either way, those are two good ways to get those names.
Okay, and I do want to continue. I'm not sure if I'll be able to do this one coming up or the January, but does it help to start with what we can do now, doing it on our own, or do you think
Absolutely.
It's better?
No, begin with it, start with it. You know, you'll work where you can, and you know, as you begin to recite the names, it will bring up a lot for you. But you know, again, that deeper work to really get into the deep heart, the soul, we call the barzakh. That's the work that you're going to want to do with your healers. Okay.
Mm-hmm. Okay, and then I'll just ask her all the other things. All right, thank you so much. Prayers and blessings.
You're very welcome. Very welcome. All right, everybody, I think we're probably at a good time to stop. I know we've been on for a while. I want to thank everybody for listening, and a special thank you to Heidi and Barb for sharing your stories. They were really profound, and they're really helpful for people. And I hope that people, remember, it's not just for you as well, but if you know people that may be sick, that might benefit, really want to have a breakthrough, to have true healing, please have them give Jamila Sontag a call at 888-2-Dr. Jaffe. All right, so everybody, we're going to close tonight. I'll do a special prayer, and I want to ask that each of you are blessed, and that you're healing. For all those of you that need healing who are on the call, that God gives you the deepest possible healing, and that all of the veils that are keeping you from having happiness and success in life and having real health in your life are healed, and that this is a very special year for you where you really break through and have everything that you want and everything that you need. Amen, amen, amen. So in the name of God, the merciful and the compassionate, I'm going to go ahead and close this evening in this call. And again, I want to thank you all so much, and hope to talk to you soon. We say, may God's peace and blessings be upon everybody.